Can one of you explain the difference between acute and chronic pain, and maybe like when a good time to prescribe an opioid would be?
I'll take a shot at that. Acute pain is basically any kind of pain that occurs as a result of an injury or acute illness or surgery. Any kind of insult that acutely damages any part of the body will create an inflammatory process, a reaction on the part of the body, which manifests in many ways, including increased blood pressure, increased heart rate. One of those manifestations is an increased amount of pain. That is a normal reaction of your body, nothing wrong with that, and usually it is treated appropriately with non-opioid medications, anti-inflammatories, but in cases where those types of medications are not effective, it is okay to try to get some help from an opioid medication. As our bodies heal, as they naturally do, as the process cools down, it is okay to taper down to off the medication and get off of them within a reasonable amount of time. Now, it all depends on how severe the injury was, how extensive the surgery was, how prolonged the illness process was. But most of the times, an acute process usually is limited to 3 months. Anything that goes beyond 3 months falls into roughly 2 categories. One is unclear mechanisms for ongoing pain beyond what is reasonably expected to occur as a normal, natural reaction of your body, or simply a degenerative process, for example, which has been going on for a long time, and it has reached a peak where things are not working according to the plan, and the body is not able to take care of itself. Those 2 forms of pain are called chronic and usually extend beyond the 3 months period. Most of the times we can take care of the acute illness with prescription opioids for about 7 to 10 days, sometimes up to 3 weeks. But when the disease process or the pain extends beyond 3 months, we're dealing with a much more complex, in which case we prefer some specialists to get involved.